I am going to talk to you today from cold Chicago, Illinois. I hope it's very nice there. I'm going to talk to you guys about PANS and PANDAS and these kinds of chronic infections that we see in our children on the autism spectrum. And I think that our kids have so many different symptoms and they're always kind of changing, almost even day to day, that sometimes we might not recognize what is happening with them, and we may not recognize that they have an underlying infection. So today I'm going to talk to you guys about some tools that you can use to recognize what might be happening in your children. What we are talking about is PANDAS, which stands for Pediatric Autoimmune Neuropsychiatric Disorder Associated with a Streptococcal Infection. And so PANS includes these infectious triggers like strep, Lyme, mycoplasma, viruses, but it also adds non-infectious triggers. And if you guys think about your children and what things set them off or what things cause them to change their behavior, probably you guys would say maybe some food that they eat. So it's possible that allergens can also trigger them. And it's possible that other metabolic factors, potential toxins in the environment, an acute episode of a toxin exposure. And then the other potential possibility is an acute severe stressor. So a major stressor in their life could potentially also trigger this kind of immune activity in the brain. What's causing most of the problem is the way the immune system handles that infection. And instead of just killing the infection and getting rid of it, what happens is in our patient population that has a dysregulated immune system because they started off their life with a problem in their microbiome, because of their immune system, they end up fighting the infection and they produce antibodies to that infection. But those antibodies get confused with other body tissue and start fighting itself. And that term is called autoimmunity. It's when the body's immune system is confused or dysregulated, and the immune cells or antibodies end up not only trying to target the infection, but they also target or attack the body's own tissue. And the body starts to fight its own body tissue. And the term for this is called autoimmunity. And another way to describe this is called molecular mimicry. So, for example, the protein structure in strep looks a lot like the protein structure in a part of our brain called the basal ganglia. So when the body fights the strep protein, the antibodies get confused and sometimes fight the brain or the basal ganglia. And that's what happens in PANDAS. So I'm going to give you guys an example of one of my patients. So the history is that she had a regression at age 6 months, and she had a history of frequent infections and fevers. And then by the age of 2, she was diagnosed with autism. She had a GI scope that showed severe colitis. And by age 6, she had IVIG with no improvement, casein-free, gluten-free diet with mild improvement. She did some chelation. She used antiviral drugs, and she used to get better with antibiotics. And HBOT gave her some minimal improvement, but she couldn't sustain it. And no improvement with chelation. Oh, I don't know why I said that twice. So then when I saw her, she had single words, she had a lot of verbal stimming, she had scripting and anxiety and a lot of mouthing and OCD. And her ATAC was around 64. So the parents had tried a lot of things, and still at the age of 10, she wasn't doing so great. On review of her lab, she showed an abnormal neopterin, which is a sign for inflammation. She had numerous IgG food sensitivities, not allergies. She had a very high vitamin D level. She had antibodies to her own brain protein called fibrillarin myelin basic protein, and they were IgM, which means that the body is fighting it acutely. IgG means a past infection. Now, if you take a look at her strep titers, they were very high. Her ASO was around 400, but her anti-DNase B, which is more of that autoimmune marker, was 2,720, and the reference range is like 300. She also had an elevated blood lead level, which tells me she's getting acutely exposed to lead. And her stool showed entamoeba, strep, staph, and protea. So she had parasites, gram-positive infection and gram-negative infection. So I started her on a biofilm protocol. I always like to treat the gut first. I used biofilm defense and some oral disodium EDTA. I used some antibiotics initially and then followed them with a rotation of herbs such as grapefruit seed extract, berberine complex, and wormwood for the parasites. And then I like to use a binder when I'm killing bugs. I use citrus pectin and charcoal. Now, after her biofilm protocol, her strep titer actually increased. Now, why would you think that would happen? I mean, you would think that she would get better, but actually her strep titers got worse. And the theory behind that is that now we're opening up the film. The immune system is seeing these bugs more and producing antibodies to the bugs. So we're going to see more antibodies as we try to fight this infection. But over time, those antibodies should come down. I started her on Zithromax with some minimal success, and I switched it to IM or intramuscular penicillin. The intramuscular penicillin, because we bypassed her gut, gave her major improvements in her OCD, anxiety, and her language. She went from words to sentences in her language, and she became much calmer. Olive leaf extract really helped her a lot as well. Remember, she had been on Valtrex, and she had had abnormal viral titers, but the Valtrex didn't really help her. The olive leaf extract improved her stimming, her behavior, and her intention. And when we added natural anti-inflammatory agents and homeopathics for inflammation, it helped her further with calming and OCD. So even though this patient had gone through various biomedical therapies, I think addressing some of the really severe underlying issue, I think for her, was the strep infection. Getting that under control helped these other things improve and helped her autism symptoms.